Alrighty. So I have started recording the meeting. Good afternoon, everyone. Thank you so much for joining us today for this press briefing about the Central Shenandoah Health District. Dr. Laura Kornegay is going to share some updates with us on the state of COVID-19 in our district. And we do have some questions that were submitted yesterday. Those will be answered following the briefing. And then should we have time, you all are free to unmute yourselves and ask questions at the end. But with that, I'm going to turn it over to Dr. Kornegay.
Thanks, Jordy, and thanks to everyone for taking time out of your busy schedules to listen to our update. We thought that this would be a great time to give kind of a current state of COVID-19 within Central Shenandoah Health District. As you all know, at the height of the last surge, our district was seeing 1,500 or more cases per week. Luckily in May, with increasing vaccination rates, we saw a steep decline in cases, and by June, we were seeing approximately 32 or so cases a week. Unfortunately, in mid-July, we started seeing an uptick in cases that's continued and is expected to continue into the early fall period. Throughout the Northwest region, which encompasses Central Shenandoah and 4 other health districts, cases have been increasing over the last 53 days, and the 7-day average for new COVID-19 cases in Central Shenandoah has been 42 daily cases reported. The vast majority of these cases are occurring in people who have not been vaccinated. So unvaccinated patients account for 98.49% of total COVID-19 cases in the Northwest region and 97% of all COVID-19 hospitalizations. We're definitely seeing higher rates of COVID-19 in areas where our vaccination uptake is lower. You can go to our website to see current vaccination rates for Central Shenandoah Health Districts, but the basic breakdown is the total population who've had at least one dose is 51.3%. The total population that's fully vaccinated is 47%. The adult population who've received at least one dose is 59.8%. And the adult population who's fully vaccinated is 55.1%. And there's significant regional variation and significant variation among age groups. Our elders who were at highest risk and really bore a lot of the brunt of the first wave of COVID-19 had a very high vaccination rate, over 80%, which is terrific. With the current vaccination rates and transmission that's increasing in our area, we're definitely at the bottom of what appears to be another surge in COVID-19. And really the biggest tool that we have in our toolbox to flatten that upcoming curve, we haven't heard that term in a little while, is vaccination. So continuing to encourage folks who haven't gotten the vaccine to go ahead and do so. There's a lot of talk within the state and within the nation of the increased transmissibility of the Delta variant. Unfortunately, what viruses do, and they do it very well, as they continue to circulate within populations, they become smarter and more of a threat. They mutate. The Delta variant is the most common variant within the nation. It's creeping up within Virginia, and VDH models indicate that about 11.9% of cases in the Northwest region are due to the Delta variant. Studies suggest that the Delta variant is about 40 to 60% more transmissible than the Alpha variant. The Alpha variant was also called the UK variant. New data show that people infected with the Delta variant also have a viral load. The amount of virus that you can get from the nasal swab that's about 1,000 times higher than the original strain. There was a an outbreak in the Cape Cod area that showed increased transmissibility, and also the fact that people who are vaccinated and become infected can potentially transmit virus, and that led to a lot of our current guidelines in terms of the importance of masking. Again, the Delta variant spreads more easily and quickly. The reproductive number for Delta variants is about 6 to 7 versus much lower numbers for previous variants. And that translates into needing a herd immunity around that 80 to 85% rate, which we've been talking about. So we still have a way to go with our vaccine campaign. The good news within our district is that where we've seen a fall off in vaccination rates, probably in the springtime as case rates continued to decline and people let their guard down a little bit. We've seen a recent uptick in attendance at our vaccine events, and at the vaccine events that we've had recently, we've had more first doses and second doses, which is definitely encouraging. Again, the key message for our community in order to prevent further disease is really those same mitigation strategies that we talked about from the beginning. The one very powerful tool that we have on our toolkit now that we didn't have a year ago is the vaccine. So we would consider vaccination the most important factor in tamping down the current surge and further transmission of disease. The other mitigation factors that we've talked about for the last year and a half remain very important to decrease spread of disease, and that would be masking, hand washing, staying home when you're sick, getting tested if you do have symptoms consistent with COVID-19, and taking appropriate measures to isolate yourself and to help public health in doing contact tracing, environmental decontamination, all of the measures, and plus social distancing, all of those measures that we started out with and talked about remain important adjuncts to our vaccine campaign. So as much as we'd like to get beyond all of those things, particularly the need to mask in public with the uptick in cases, we really have to go back to those layered mitigation strategies that allowed us to successfully get through the previous surges. I think one of the encouraging things, especially as we start the school year, is looking back at the previous school year and evidence that shows that with layered mitigation strategies on those 3 W's, washing your hands, watching your distance, and wearing your mask, classrooms were actually very safe places. We saw little transmission of COVID-19 in classroom settings, and in-person education with those layered mitigation strategies last year was successful. A lot of the transmission that we saw associated with school-age children was really with extracurricular activities and things outside the classroom. I think we saw what a toll non-in-person education, virtual education, took on children and parents alike. And the goal for this school year was definitely to get kids back into in-person learning. With increases in cases, the way that we're going to be successful with that is the same way that we were successful the previous school year with all of those layered mitigation strategies. Unfortunately, a lot of our K through 12 students are not yet eligible for the vaccine. We do have very good vaccination rates among see teachers and adults around them in school. So that's going to help in giving kids that protective bubble of vaccinated adults around them. But until we have additional vaccine available for younger age ranges, it's more important than ever to both have adults vaccinated and to implement those successful layered mitigation strategies to prevent transmission within the classroom. Virginia as a whole is at a level of substantial transmission at this point in time. Cases have increased by about 956% since mid-June, and unfortunately hospitalizations are also increasing. So again, the way to reduce the risk of being infected and possibly spreading disease to others is for everyone, even if you're vaccinated, to wear a mask indoors in public if you're in an area of substantial or high transmission. And that includes the majority of Virginia at this point. Vaccination really is our only strategy that's going to safely bring an end to the pandemic. And we're lucky enough to have 3 vaccines that are both safe and effective against COVID-19. We really have to increase that vaccination rate in order to get ahead of the ever-increasing surge and the spread of the Delta variant. I think when you look at the national news, Virginia is doing better than some of its counterparts. But as Dr. Fauci and national leaders have said, it's really kind of a race between vaccination and the spread of those more contagious variants. Vaccination with any of the 3 vaccines in use in the U.S. prevents both severe illness, hospitalizations, and death. And that's really what they're designed to do. We don't have any vaccine that we use commonly that protects 100% against illness. However, what these vaccines and other highly effective vaccines that we typically use for children and adults do, and they do well, is to prevent severe complications of the illness. And in the case of COVID, that would be hospitalizations, ICU stays, and death. The variants that are circulating are causing some vaccine breakthrough infections, that is, people who are fully vaccinated. And by fully vaccinated, we would define that as somebody who had one of the mRNA vaccines, Pfizer or Moderna, is at least 2 weeks past the 2nd dose, or someone who had the J&J vaccine, 1 dose, and is at least 2 weeks past that single dose. Those people can become infected, but the infections in general tend to be mild. And importantly, what they do is prevent you from ending up in the hospital or ending up dead as a result of COVID-19 infection. We'll talk a little bit next about masking guidance. That's been something a little bit in evolution. I mean, you can see by the discussion surrounding back to school guidelines that things have been changing rapidly, really until the point when more people are vaccinated and there's substantial or high transmission in communities. Wearing masks remains an important tool to help stop the spread of COVID-19. In areas where you do have substantial or high transmission, the recommendation is that everyone should wear a mask in indoor settings, even if they're fully vaccinated. And again, nearly all of Virginia is experiencing substantial to high transmission at this point. CDC recommends that people, including children older than the age of 2 who are not fully vaccinated, should wear a mask in most indoor settings, maintain that social distancing of about 6 feet, regardless of the level of transmission within the community. Again, masking remains just that additional tool in our toolbox in addition to vaccines to help get us through these surges. The cases, as with Central Virginia, are rapidly increasing within Virginia as a whole. Again, they've increased by about 956% since mid-June. Hospitalizations, unfortunately, are also increasing. As of August 4th, they've increased by 31% from the week prior. Nationally, we're seeing significant effects of COVID-19 surges in other states, and luckily Virginia is not at that point. But what we need to do is really buckle down with the mitigation efforts and increase vaccine efforts to prevent from getting to that point. Getting vaccinated, again, remains the most important step for protecting both yourself and others. And getting vaccinated, you prevent yourself from getting infected. You also protect the people around you, family members, from getting infected. And you add to that population immunity that's going to allow us to get beyond this COVID-19 pandemic. We'll talk a little bit about schools and COVID-19, as a lot of our school districts have started this week or will be starting up in-person learning next week. Virginia Department of Health, Centers for Disease Control, and the American Academy of Pediatrics all recommend that school districts require universal indoor masking for all teachers, staff, and students and visitors in K through 12 schools, regardless of vaccination status. Again, that's going to protect the classrooms. As with last school year, with in-person learning, we can make classrooms a safe place for in-person learning with putting these layered mitigation strategies into effect. Children at this point who are less than 12 years old are not eligible for vaccine at this time. It's expected that the Pfizer vaccine will obtain emergency use authorization for that next age group, which would be the 5 to 11-year-old age group in the near future. The last estimate that I saw from Dr. Rabula at the state level was that that may occur as soon as the September timeframe. And certainly public health remains at the ready to deploy those vaccines to those younger age groups and continue our vaccination efforts in the younger age cohort. SB 1303 was a bill that the governor mentioned at his press conference last week, and that was passed by the legislature this past spring and went into effect on July 1st. And this bill requires K through 12 schools to open for in-person instruction in accordance to the maximum extent applicable with CDC guidance. So it asks schools to follow CDC guidance for safe in-person learning. And again, that CDC guidance recommends universal masking for everyone in K through 12 settings. Along with that, the CDC order also requires universal masking on school buses, and school buses fall under the federal category of transportation. So masking on school buses remains universal for school bus riding. One thing that we'll talk about next is the state of booster shots and then FDA approval for all three of the vaccines. As you know, the current vaccines are under emergency use approval. They've been well studied. They've been found to be safe and effective for preventing serious consequences from COVID-19. The one thing that they lack at this point is full FDA approval. And some of that hinges on not only their track record with being safe and effective, but also numbers of people who've received it, and kind of that time factor of looking how the vaccines operate in a real world setting. The vaccines have shown to be an excellent tool in helping combat the pandemic. And they're getting to the point where they should receive that full and final approval from the FDA and be removed from just that emergency use approval. So that should be in the offing. The FDA had originally set a goal for making that happen by January of 2022. It seems like it's probably going to be more towards the fall timeframe, but we expect that Pfizer, kind of being the oldest vaccine on our roster, will obtain that the quickest, and that should be forthcoming in the fairly near future. Just today, there was a New York Times article about third shots, booster shots for immunocompromised persons. That represents probably about 3% or so of our population who, for one reason or another, have weakened immune systems. The Advisory Council on Immunization Practices, which is our guidance for vaccine administration, has met at least once or twice and discussed this very issue, and it's expected that the recommendation will be forthcoming that a third shot should be recommended for immune-compromised persons. So again, that would be something that a primary care provider could talk with patients about. The patients themselves are probably aware of their own status, but that's looking like that's going to be approved very, very soon. So what actions do we need to take to be ready for surges in our community? Again, the vaccine is the greatest tool in our toolbox, so continuing to encourage uptake of vaccine within our communities. We've had great community support from multiple partners throughout the district for our vaccine efforts. In the springtime, we went from mass vaccine distribution, where you would see very large efforts at big venues, such as the Rockingham County Fairgrounds, and more. Now we're working more on targeted efforts within smaller community settings. As I said, we had a drop-off in vaccine uptake in the spring and early summer, but as cases started to increase and concerns started to rise, we've seen a nice increase in attendance at community vaccination events. We also continue to provide vaccines for homebound and vulnerable populations, and are really trying to make sure that access to a vaccine is not a stumbling block to getting it. So along with a lot of our community partners in the area, we've really pulled out all the stops in attempts to get everyone who wants a vaccine access to that vaccine. The other tools in our toolbox in cases of surge are the same things that we've been talking about for the last year and a half, and those are those layered mitigation strategies, wearing your mask in public places, trying to maintain distance, trying to avoid large crowds where you'd have more exposure to people who may transmit disease. Washing your hands, that always remains an important mitigation strategy. Staying home when you're sick, getting tested when you do get sick to determine whether this is COVID or another respiratory virus that we tend to see an uptick in in the fall time frame, and then isolating if you're sick for 10 days, and if you've been exposed, quarantining per appropriate health department guidance. With the advent of vaccines, we're in a different situation now in approaching exposed persons than we were a year ago. So the recommendations, if you've been fully vaccinated and you come into close contact with somebody with COVID-19, is that you should be tested 3 to 5 days following that exposure, and then wear a mask in public indoor settings for 14 days or until you receive a negative test result. If a fully vaccinated person tests positive, unfortunately, then they're a case, and the same isolation procedures would go into play, and that would be isolating for 10 days or until your symptoms are substantially resolved. The good news for vaccinated folks is that they tend to have mild illness, and much less than 1% of those folks will have any serious consequences from COVID-19. So again, vaccine is our #1 tool. The other tools in our toolbox remain the same. And we did successfully get through other surges using all of those layered mitigation strategies. We now have that additional one of vaccination that will, help us with this current surge. So I think our message remains largely the same, encouraging vaccines, using all of those mitigation measures to prevent disease, and then watching the situation within your area to know what transmission rates are like. We're hoping again that we can go back to some of those oft-repeated phrases in the past and kind of flatten that current curve with really making a concerted effort at increasing vaccination rates within our communities. We really appreciate all of the help that our localities and community partners have given throughout the COVID-19 pandemic response. Without the support of all of our public health partners within our communities, we never would have been successful as a sole entity at the local health department level with having successful containment efforts. It's really been a team effort, and we've done great work to date, but unfortunately our work's not over yet. So I think our team at the local health department has been able to take a bit of a breather during the summer lull. We got a little bit of rest, but we're ready to hit the ground running again, and hopefully, avert a large peak in cases come the fall. One of the additional tools that we put into place at the public health level is building teams over the course of this pandemic. Again, the magnitude of the number of cases was well beyond what our public health team could do by itself. So over the course of the last year and a half, we've built contractor teams that have been helping us with case investigation, contact tracing, and epidemiology. Those teams remain on board, and they're framed as our Containment 2.0 team. They're working on containment of COVID-19 infections within our district, and also working on case investigation, contact tracing, and outbreak investigations. They're in effect a parallel team to our health department team, and are able to help us continue with COVID-19 response, but also incorporate more of our core health department activities going forward. A lot of public health issues have really been terribly exacerbated by the last year and a half due to decreased access to services throughout the stress of the pandemic. We've seen increases in issues related to mental health, addiction, decreased immunization rates for children and adults for routine non-COVID vaccines. We've seen increase in sexually transmitted infection rates. We've unfortunately had a lot of secondary effects from the pandemic that we need to start aggressively addressing, and the fact that we have these parallel containment team is helping our local health department teams to spend more time on some of these issues that were really overshadowed by the magnitude of the pandemic. So we'll continue both COVID-19 response and getting back to our core public health work, which have been continuing all along, but at a lesser level. I think that's the main messaging that I had to share. Jordy, do you want me to go ahead and address the questions that were sent in first?
Yeah, that would be great. I can read them out to you, or if you have the list, you can just go through whichever works for you.
Yeah, I have them right here, so I'll read the questions. We had a couple questions from Bruce Young from WGBJ 7. His first question was, much of Central Shenandoah Health District, with the exception of Harrisonburg, has been spared from the large number of cases seen in other locations. Are you afraid this might cause people to be lax in their desires to get vaccinated or take precautions? I think that's always a concern when you're not immediately personally affected. Sometimes it does affect behavior, but I think what we need to look at is the total picture of COVID-19, which is that we're currently in a global pandemic. I think one of the differences between this pandemic and, say, the 1918 flu pandemic is that we're really a global society, and we're going to be affected by what's going on, well beyond, our smaller borders. So everyone needs to take the threat of COVID-19 seriously, and they need to do everything that they can to protect themselves and their families against disease. And the action that you can take right now is to get vaccinated. So hopefully people understand that message. Then the second question was, do you think the rise of the Delta variant will perform similarly in terms of spread in places like Bath and Rockbridge? I think that the Delta variant, once it gets into a population, behaves the same, whether it's a large population or small population. The thing that is going to affect the Delta variant or any other variant of COVID-19 is vaccination. That again, in Virginia, we're seeing that the biggest burden of this current disease surge is in unvaccinated persons. So vaccinated people, they're not 100% protected from infection, but nearly 100% protected from the severe consequences. And vaccination is also, our best protection against infection. So whether you live in a small community, a large urban center, that vaccination is going to be important. And if you haven't taken advantage of that yet, taking advantage of that now is going to be crucial. The next set of questions was from Randy B. Hagee, WMRA, WEMC. And the first question was, it appears that most localities in the health district have seen an increase in new cases in the last 4 to 5 weeks. How much of that is driven by the Delta variant, and what other factors you believe are contributing? So at this time, about 12% or so of the cases in our district have been identified as a Delta variant. The one thing that's important to note when you talk about variants is that the way we determine a variant is by obtaining a PCR test and then doing what's called whole genome sequencing, kind of figuring out the genetic makeup of that specific virus. Whole genome sequencing is not done on every PCR test. The state lab, DCLF, has a robust whole genome sequencing division that's been working on typing variants really throughout the pandemic. But the way that they do that is either through random surveillance, so obtaining tests and randomly testing for variants and doing the sequencing, or by directed testing. So for instance, if we identified a vaccine breakthrough case and we were interested in determining whether this was Delta or another variant of concern, we may get that patient's PCR test and ask our state lab if they can do whole genome sequencing. So again, 100% of the tests that are obtained don't have sequencing done, but the random testing does give us an idea of the impact of variants within the state and within our regions. If you look on the VDH website, we have yet another dashboard that's called Variants of Concern. And you can look at the trends in variants that are being tested, and you can see really since the time where we saw an uptick in cases, probably mid-June or so, an increase in identification of the Delta variant. So you can look at that and see what the situation is in Virginia. Again, a couple things to keep in mind is that not all tests are sequenced, and then the sequencing takes some time, so that dashboard is going to be a little bit of delay between the need to work on it to identify that sequencing and then getting it reported up on the dashboard. I think an important thing for the public to bear in mind is that I think it's really important from a public health aspect to have this information available and know what the behavior of these different variants is. That's a very important public health information. From the perspective of a single case, a single infection, whether you have an alpha variant or a Delta variant, your treatment is going to be the same. That if you have a COVID infection, it really doesn't impact, the treatment for you by knowing the variant type. So from an individual perspective, not really important information. From a public health perspective, very important information to know what's circulating and what the behavior is and kind of what to expect as that becomes a more predominant strain. So the second question that Randy had was, what is our current capacity or protocol to determine if cases are caused by the Delta variant? So I spoke to that a little bit. Again, not every test has whole genome sequencing performed, but the state lab or DCLS has a whole genome sequencing program. They do random surveillance of testing throughout the state. and that gives us a good snapshot of what's going on within the state and within the region. We can also direct tests. You know, a physician may say, oh, we have this person in the ICU who has, you know, severe disease. We want to direct it for variant testing or for vaccine breakthrough cases. It would be interesting to know, what variant is causing disease. We can also direct tests up to the state lab as well. And then the next question that Randy had is, are we seeing any changes in outcomes for local residents who contract the Delta variant? And that's a great question. I think, again, it's a difficult one to answer at the local level, because not all of the tests are sent for whole genome sequencing. And again, the approach at the individual level to a person who has COVID-19, particularly if they have severe disease, is going to be the same regardless of the variant that's causing disease. Nationwide, we're monitoring how the Delta variant behaves very, very closely. I don't think we have all the data together to really speak to that from more than broad brush observations. And it seems like nationally that you're seeing a couple different trends. One is probably more hospitalizations than we saw with the last surge. The other is younger people being affected. But I think we need to gather up more knowledge with how this variant behaves over the course of time. And then the last question that Randy had was, how many new cases in the health district are happening to vaccinated people, and how many of those are actually showing symptoms? So again, in the Northwest region, which includes Central Shenandoah Health District, 98.49% of all cases occurring are in unvaccinated people. Most of the cases in vaccinated people tend to be mild and do not require urgent medical attention. So again, the vaccine is doing exactly what it should be doing. In most cases, it's stopping disease. And then in those cases where it doesn't halt disease, it's preventing severe outcomes such as hospitalization and death. So again, a really, really powerful tool individually for protecting your individual health, for protecting the people around you, and also is going to be, our way into a post-pandemic world. The longer viruses can find susceptible hosts within a population, the more propensity they have to mutate. Those mutations generally follow the survival of the fittest rule, that the ones that tend to survive and propagate within populations, are faster, stronger, and more devastating than the previous version. So the race with getting people vaccinated to win against these viral mutations is a real one. And like I said, the message continues to be get vaccinated. So Jordy, I don't know if I see some additional questions in the chat. Do you want to read those out?
Yes, so we did have a question from Ian Monroe with the Daily News Record, and that is, what kind of outreach is the district doing during fair season? Will there be a booth set up for vaccines? And will health district workers and first responders be at the Rockingham County Fair next week on August 20th and 21st?
Yeah, we are talking with the county about being available for vaccinations at the Rockingham County Fair. So we're working on efforts for that. We continue to do outreach at almost every venue that we can imagine where people gather to try to improve vaccination rates. Providing education. Sometimes people just need their questions answered in order to, feel comfortable with going ahead with the vaccine. So having health workers available to answer those questions and people available to give vaccines is our intention with the fair. We've been at a lot of other community events throughout the district that range from things like high school graduations, drive-in movie theaters. We did a Vax in the Valley campaign along with Augusta Health that included some musical entertainment at a couple of different venues. So really trying to meet people where they live and make it as easy and seamless as possible to obtain the vaccine.
Great. So the next question we have is, what needs to happen between when the FDA approves a booster for those who are immunocompromised and when the booster is available to eligible people in Virginia?
The booster should be kind of immediately available to eligible people. So you would obtain the booster, anywhere that you would obtain a vaccine. And luckily with our vaccine availability, there's lots of different places where you can go to get vaccinated. That may be your own primary care provider's office. It may be a health department event. It may be an event sponsored by one of the hospital systems. It may be a CVS or a Walgreens. So wherever you went to get the first two vaccines, you could present back for the third one. The roadblock to getting that third one is approval. For the third dose. Everyone generally operates under the Advisory Commission for Immunization Practice guidelines. And thus far, there's not been a recommendation for third booster doses for immunocompromised persons. There has been concern amongst clinicians who provide care for such persons that, that thinking that a third dose would be warranted, but until that guidance from the FDA is given, that third dose is what we would call an off-label indication. But once that guidance is given, you should be able to obtain a third dose wherever you got the first two, or in any of those multiple venues where you can get a dose within communities.
Awesome. So we've got a few more. We have one of them is, will IHEs be assigned a direct contact from VDH to assist with case and outbreak management like we had last academic year?
Yeah, so part of our, I spoke to our Containment 2.0 team, and we have members of that team who are assigned to specific sectors. So we have folks that we've trained up, just as we had, our internal staff on sector-related issues and outbreaks. So we have people who are devoted to K through 12 and higher education, people with specific knowledge in long-term care facilities and healthcare settings, people who are assigned to business sector. So yes, we have individual contacts within that team that we've been kind of introducing around during meetings with various school districts and other sectors.
Great. And then from Monique Kaleo with the news leader. What are your guidelines inside the schools with quarantine if a student has been exposed to another student who tests positive with COVID? And,
Yeah,
folks have been hearing different strategies and hope to clarify.
yeah, that's a great question. And again, with the advent of vaccination and the mitigation strategy of masking, the CDC made a exception to the close contact rule within the classroom setting. So generally, we would consider a close contact to be anyone within a less than 6-foot distance of a case for a cumulative period of 15 minutes. And previously, that had been masked or unmasked. With schools going back in person, with the recommended distance within schools being 3 feet, and with data from previous school years, the previous school year with schools that had used the 3-foot distance and masking, the CDC felt comfortable with making an exception to that close contact rule for kids in classrooms. So if both parties, both kids are masked and they're within their 3-foot or more distance apart, as they should be within the classroom, that contact to the child would not be considered a contact to a case. So again, if you can maintain that 3-foot distance in the classroom, everybody's masked, a nice fitting mask. Everybody's wearing one. They're wearing it consistently. If you had a case in the classroom, we wouldn't have to take, a whole bunch of that child's contacts away from in-person learning. And that only applies in the classroom setting, and it only applies to students. It doesn't apply to teachers or staff.
Awesome, thank you. And then the next question is, do you have a 7-day average or positivity rate that will mean closing schools? What plan do you have in place, and what can families look to so they can plan versus react to surges inside schools?
Sure. Just as with last year, we don't have any specific triggers or specific numbers that would cause us to close school. And definitely the goal of public health and the Virginia Department of Education is to try to continue to operate schools safely with in-person learning, because we did see the toll that virtual learning took on really all of our communities, in addition to parents and students last year. If you look on our website, we have nice interim guidance for K through 12 education that includes discussions of both the transmission rate within our communities, and we look at transmission rate and percent positivity, and the triggers to high or substantial would be the higher of those two. So looking at what's going on in your communities, and then looking at the effect within the school system. So things that the schools need to look out for is, increased absenteeism, increased reports of illness, and, see what's going on within the school system, and really be able to pivot to increase any mitigation factors if they see upticks in disease spread. It talks about triggers for kind of increasing efforts, but really doesn't speak to any specific triggers to closing. I think one of the important adjunct tools that the schools will have access to this year through significant federal funding is testing in schools, particularly surveillance type testing. On our website, it describes the testing program that schools can elect to be a part of, and through funding, federal funding channels, with VDH kind of as the intermediary, schools can really take advantage of testing that should also help to define better what's going on with, on the ground, and hopefully prevent closures. Again, if you can jump on things quickly, contain the situation, to maybe a single classroom or single sports team, take appropriate public health measures. Our goal and our hope is that we can avoid, closing schools. And we were able to, for schools that offered in-person learning this past semester, I think schools were effective in being able to do that. And again, it's using the same tools, but with that great addition of the vaccine element. So we're keeping fingers crossed for a successful, healthy, in-person fall semester for all of our K through 12 students.
Great. So we have another question that is VDH considering standing up regular community testing events or sites again, given the current surge in cases?
We would be able to, upscale our community testing events again, as needed. So we'll just keep looking at what's going on in our community in terms of cases, and also look at what's going on in our community in terms of access to testing. I think we're at a much different point now than we were this time last summer in terms of more robust access to tests, in a lot of different venues, be it, private offices, urgent care, now the schools. So as we need to, we can certainly set up those community testing events. And as part of our Containment 2.0 team, we have a testing team that would be available to help with that. We also have access to some turnkey vendors that we worked with last year who could also help with testing events.
Great. So the next question we have also from Monique is, given the recent studies on waning immunity, what can we tell people who are already 6 months out from their last vaccine, especially regarding the Mayo Clinic report?
Yeah, again, our guidance in terms of boosters for both the immunocompromised and boosters for the general population is coming from a lot of data that's being gathered and evaluated by the FDA and the Advisory Council for Immunization Practices. So the Advisory Council for Immunization Practices meets regularly and decides these questions and puts out guidance that guides both public health and all providers for COVID-19 vaccine as to what direction they should go in beyond what's already available. So I think most experts expect that there will at some point be a recommendation for booster doses for the general population, but until we get that guidance based on evaluation of ongoing collection of data, we just continue with the recommendation for the 2 doses of the mRNA vaccine and 1 dose of Johnson & Johnson for the general population.
Great. So it looks like right now we've got 2 more questions in the chat so far. So the next one is, can the revised CDC classroom close contact definition apply for students in the higher ed versus K through 12 setting if the 3-foot spacing is maintained and masks are used consistently?
Good question. I don't think the guidance spoke specifically to K through 12 education, so I don't have an answer to that, and I don't think there's that such guidance directed as yet at higher education.
Alrighty, and then the last question I'm seeing in the chat is that you mentioned people will be able to receive the booster at the previous locations where they received their original doses. Does this mean that VDH will be scheduling community vaccination events as they did during the original vaccination push?
We have community vaccination events throughout the district that have been ongoing. And you can access that on our website and on our CSHD page, which has a newsletter that outlines all of our weekly events. Vaccine Finder remains another area to look for vaccines within the general population. We've also incorporated COVID-19 vaccines into our, day-to-day health department activities. So the local health departments now have the ability to give COVID-19 vaccines, as we always have with childhood and adult vaccinations. Again, the immunocompromised, I think I saw an estimate kind of nationwide that's about 3% or so of the population, so relatively small percentage of the population. So I don't think with that percent of the population that we need to stand up, large events, as we did when we rolled out the vaccine campaign. I think the other thing we'll have to figure out how to operationalize is, how we be able to identify folks as immunocompromised. I'm suspecting that it would be just a self-report by patients, attesting to that, but we'll have to get a little more guidance on whether we need, a physician's note or the like. I suspect not. A lot of what we did when the vaccines were first rolling out was just self-attestation of what your chronic disease process, was. So I suspect that the same will apply to the booster for immunocompromised, but more to come on that.
All right, well, that is the last question that I saw in the chat. Does anyone else have anything else that they'd like to ask? You're free to unmute yourself and ask questions if you have them.
Hi, it's Monique again. I don't want to be too pestery on this, but what do I say, just because I'm trying to figure out the language to give to the older population who have already begun to contact me again with the boosters? Do I just say you're waiting to see from the advisory council that the health district can't make that decision individually? They have to wait for the CDC and the advisory council. People are already reaching out saying about the boosters, especially since they have become available in different areas. What would you say to someone so I can know what to say?
Sure. Well, just as with everything, we want to make a data-driven decision in terms of the need for boosters. So the FDA and others are gathering up research, looking at immunity levels and determining whether a third dose would be needed for the general population. Not just the health district, not just the Virginia Department of Health, but everyone within the United States who's an immunization provider follows Advisory Council on Immunization Practice guidance. They basically set the guidelines, and that's what's followed for general practice. So these issues are being looked at. As soon as we get guidance that a booster is needed, we'll certainly act on that. In the meantime, definitely making sure you have your primary immunizations completed, that you've done the 2 doses of mRNA or the 1 dose of Johnson & Johnson. And then as we're seeing increased levels of transmission, putting all those other mitigating factors to work, wearing your mask, avoiding crowds, washing your hands, keeping your distance, monitoring your health, and adding all of those protective tools to keep you healthy during a surge.
Thanks.
Thanks, Monique.
All right. Anybody else have any questions? Okay, then I'm going to go ahead and stop recording this now.